depression, uncertainty, fear. Did you recognize those after your diagnosis?
Absolutely.
Okay.
Particularly the shock.
Okay.
It is a terrible shock, and I used to, when I was first diagnosed, I compared it to the feeling of being dropped out of an airplane without a parachute. Or I've heard it being compared to a sniper fire, being caught by a sniper fire, because it's just a total shock.
Okay.
And I thought, my first reaction was, are you sure you got the right biopsy slides? Are you sure you got the right slides? That can't be me.
And in that period of time where you're still coming to terms with the fact that actually it was your biopsy slide, did you talk to anybody about it, or was it something that you just needed to be at peace with inside of you? What did you do during that time?
What helped me was getting information.
Okay.
That, for me, was the best way I could gain control over what was happening and begin to believe it. And the other thing that helped me was talking to people. It's interesting because some people react just the opposite. They don't want to tell anybody. And for me, it helped me to accept what was really going on by telling everybody I could think of.
Okay. And what kind of reactions did you encounter from people that you told?
Actually, everyone that I spoke with was very, very supportive and helpful. It turns out, got a tremendous amount of support from both family and friends. And over the long term of my treatment, that support continued. And it was the ideal situation for one to be in, actually. It was wonderful.
So you didn't encounter people sort of pushing you away? Or I know that there's been times where I've worked with clients in my practice who might receive a diagnosis like this, and other people just sort of want to keep their distance, almost as though breast cancer is catching or something like that. So I'm glad you didn't have that experience. Okay. So part of dealing with the emotions is getting information, and there's also, you mentioned a practical set of steps that goes on once you've received this kind of diagnosis. You mentioned first there's a biopsy, and then what happens?
Well, after first seeing the doctor, there's an examination of the lump, if there is a lump, or the examination of the mammogram, if the worrisome area of perhaps calcifications is shown on a mammogram. Then you do have a biopsy, and after the biopsy you receive a pathology report, and that is what the important information that tells you what kind of breast cancer it is, and then tells more about the personality of your particular breast cancer.
Okay.
And that helps the doctor and you to determine what surgical procedure might be most appropriate for you. And that's putting it very simplistically.
Yes.
It's not really, you know, all that easy as you go through it. And as Pat had mentioned earlier, it's we women have worked so hard for choice, and at a time like this, sometimes it's difficult to make that choice. Whether one should have a biopsy or a mastectomy. But there are clear markers that help that decision, you know, what you should have. When you have a lumpectomy or a mastectomy, at that time they usually also will do a lymph node dissection. And they remove a section of tissue from the underarm and the nodes, and that is to see if the disease has metastasized to the nodes, and that's used primarily in helping to determine best treatment choice.
Okay.
Post-surgery.
Okay. So if it has metastasized, which I believe means it has spread
To the nodes.
to the nodes, okay, then that might indicate it might be best to go ahead and do a full mastectomy?
Not necessarily. It
Okay.
really determines more the type of treatment.
Oh, okay.
Chemotherapy.
Oh,
What type of
okay.
chemotherapy would help this woman, you know, best get back to health again.
Okay, and is chemotherapy always part of the treatment of breast cancer?
No, I don't believe so. My understanding is that there's some dispute medically in the medical field about whether it should or shouldn't be, but I've known a number of women who just have had lumpectomy and then radiation.
Okay.
And I had a mastectomy, but I did not have chemotherapy because I had very early diagnosis. I didn't have my disease was noticed on a mammogram, but then because I didn't have clear margins in my biopsy and it was multifocal, with 2 opinions, it was recommended that I have a mastectomy.
Okay.
Not everybody does have chemotherapy.
Okay. So part of the process then is once you've been through primary treatment, which could be lumpectomy, whatever you have, then I imagine that there's a series of follow-ups to check and make sure that they've arrested the disease. Is that right?
Yes.
Okay.
Ongoing follow-ups,
Okay.
which the intervals between the follow-ups decrease as the time goes on. It starts out every 3 months. You have a full range of checkups.
Okay. And what's that like emotionally in terms of the follow-up piece? I imagine that has its own difficulties.
It's very difficult. I don't have personally so much trouble with the checkups. Some people do. They don't sleep the night before their checkup. But with me, the part that I find difficult is any ache or pain that ordinarily you would dismiss can be associated with metastasis. So any ache or pain, if it lasts longer than a couple weeks, it tends to make one a little nervous. So that's the more difficult part.
Well, and I would imagine, I know after a lot of other kinds of illnesses, particularly ones that are fairly traumatic, there's a level of self-care and physical attention to nutrition and exercise and that sort of thing that I think is part of ongoing recovery, I would imagine. That because of that, I mean, in terms of wanting you to be as in good a shape as possible.
Yes. And this is the thing that's hard for me personally with 3 young children, is trying to get enough exercise and eat right. And yes, it is very important. Yeah.
And in some ways, though, and I'm just projecting this, but I would think that having to take good care of yourself might also be a reminder. I mean, I would wonder, is there ever a tendency, once you've been through something like this, to want to put it behind you and sort of try to go back to your life as normal? Or is it such a degree of brush with mortality that it's impossible to go back to normal?
I think that varies very much woman to woman.
Okay.
It's a very individualized thing. Some people do, want to just immediately, or are able to put it immediately behind them. For others, there are things that make that not quite so easy. Something might show up on a test that, brings back the anxiety again, and it varies woman to woman, I think.
Well, and that same dynamic would play in terms of support, too, because if I want to move on, then I probably wouldn't seek out a support group with you, because being in a support group would then continue to bring this issue up.
Many people, once their treatment is over, fade away from their support groups. They want to get back to life as normal, as it was before, as much as they can, yeah.
And yet, there must be such a profound touching of you in terms of your belief system and your spirituality, your sense of who you are as a woman. I mean, I can't imagine you can go, like having a broken arm set. I mean, there must be some profound shift that must happen, even if you do try to go on. I don't know, but when I think about it, I think that.
I think for most women, it's a process. Would you say, Pat? It's not something that one accomplishes quickly and easily. It's a journey. Breast cancer recovery is a journey. And the steps would vary for individual women, but I don't think it's something that happens immediately.
Okay.
Takes time, takes patience to get confidence back in your body, to feel well again. If you've had very aggressive chemotherapy and treatment, as Pat did, the physical and the emotional body needs to heal.
Okay. Well, and you're talking about in the case, particularly mastectomies, I mean, you're talking about a new body in some ways. I mean, adjusting to a new way of viewing yourself. How about the role of families during this period of time? I mean, you mentioned you had a supportive family. Do women who come in, is that common for families to be supportive, or in fact, do the families get frightened and not really want to?
All of the above.
Okay, all right.
Yes, I mean, some family members, have a great deal of difficulty dealing with it, both, like teenage children or spouses. Others are tremendously supportive. And for some people who want to be supportive, sometimes that's difficult to know what to do, what to say, to stand back, to jump in and help.
That is a wonderful point. I mean, it really is I would guess part of the assertiveness of walking through this disease is being willing to tell people what you want and what you don't want. Because I would imagine it's impossible to guess.
I do recall in the Young Moms group, I don't know if you remember, Pat, but one of the issues that came up was it was difficult for the young women to accept help, you know, from school moms who wanted to make a casserole or whatever. And I can understand that because, you know, here they are young and energetic and wanting to be mom, you know, wanting to
Absolutely.
care for their family.
Well, and now your children are little. Were they aware of your diagnosis or treatment at the time?
We were very honest with them and very open and used the words breast cancer. And it was very shocking to them, particularly the oldest one knew what the concept of cancer was. But we felt that it was the best way to handle it. Yeah. And he was lucky in that his first grade teacher at the time had breast cancer.
Oh, okay.
So she handled it with the whole class, and she handled it very well. So they had a lot of opportunities to absorb this information in different ways.
Okay. And so, as you have continued to do follow-up treatment, do they continue to ask about it, or have they let it go, or?
I don't think they ask about it anymore.
Okay.
Infrequently, I hear little comments, but I used to hear a lot of comments from my middle child who would say, "Mom, can you get toe cancer? Can you get finger cancer?" I mean, but I don't hear much of that anymore.
Okay. Well, that, you know, in terms of including the children, I mean, that's a very brave thing for you to do. I mean, ultimately, of course, as a clinician, I think, in terms of mental health, I think, you know, having secrets, something that's unspoken, is probably far worse because you've got this gray cloud, perhaps, and nobody's calling it by name. So, and yet, acknowledging your own reality every time they ask a question, I would guess, has its own pain to it too. We're going to close. I want to thank you very much for coming today. I appreciate it. And I'm sure the people, particularly the women watching tonight, will appreciate the information you're putting out there. And we do have, I know, your information, which Emerson will show us about your agency. Okay? Thank you for joining us tonight. In the upcoming weeks, we'll look at parenting ADD children. I'm Mary Crocker Cook. Good night.